Hello, good afternoon. My name is Dr. Manisha Singh. I'm a senior consultant gynecologist and head of department, subspecialist in reproductive medicine and reproductive surgery at the Fortis Hospitals, Banarghatta Road, Bangalore. Today, I'm going to talk about IVF or in vitro fertilization, or commonly called test tube baby. So essentially, in a normal woman, what happens around the time of fertilization is that a single egg is released by the ovary around the time of ovulation, which may be anywhere between day 11 to day 20, depending on how long your menstrual cycle is. This egg is then picked up by the fallopian tubes, and the sperm deposited in the vagina at the time of intercourse travels along the uterus into the fallopian tube to meet this egg or the oocyte, fertilize it, and create an embryo. This embryo then travels down from the fallopian tube into the uterus to implant, and this then becomes the baby. Now, there are many people or couples that cannot get pregnant naturally. Now, typically, 1 in 10 couples in today's world struggles to achieve a pregnancy. There may be reasons that may be pathological reasons, but what we see commonly is that today it has become very hectic for the couple. The man and the woman both are working and they do not have time for sex. In view of this, intercourse at the right time is not possible, and they need to avail of assisted conception because time has passed. Now, the woman's fertility is at its prime till the age of 35, and thereafter it declines because the egg reserve comes down in the ovaries. So, if you have to achieve a normal pregnancy, you must try at least before the age of 35. Thereafter, you can get pregnant, but it is a little bit harder and you need more attempts. So, therefore, you may need to visit a gynecologist or an infertility specialist to achieve your aspiration of a pregnancy. Now, IVF typically is the last resort where it comes to the different techniques of trying to help you achieve a pregnancy. We would start with follicle monitoring, followed by ovulation induction to make the eggs grow in the ovary. If that doesn't work, we take you through intrauterine insemination of the sperm, which is IUI. And if between 3 and 6 cycles of IUI do not work, we go to IVF. Now, IVF essentially means that we bring about the fertilization of the egg and the sperm in the lab. Now, this entails stimulating a woman's ovaries for a period of 10 to 12 days with hormone injections. Through this period, we do scans, we do blood tests to ascertain that the response to the hormonal stimulation is good. Following 10 to 12 days of injections, we arrange to collect these eggs that are growing in the ovary via an ultrasound guided procedure. So the woman is given a short anesthetic, and with the help of transvaginal ultrasound, we access the ovaries from the vagina and we aspirate or suck out the eggs from the ovary. These eggs are then transferred to the lab, and on the same day as egg collection, the husband will give a semen sample, which will then be injected into the egg through intracytoplasmic sperm injection, or just 100,000 sperm may be placed around each egg through in vitro fertilization. This is how we will achieve the formation of an embryo 16 to 18 hours later. These embryos are then cultured in the lab for between 2 and 5 days, and the embryo transfer may be done in the fresh cycle, or if some parameters are not appropriate, we may freeze the good quality embryos only, and the lady will be asked to come in the following month to avail of the embryo transfer, which means the frozen embryos will be defrosted and we can then use these embryos for transfer. Now, who are the people who typically need IVF? The very first IVF baby was Louise Brown, and her mom needed IVF in the 1970s because of tubal factor, which means the fallopian tubes were damaged. Now, as I said earlier, the fallopian tube is the location where the egg and the sperm must meet to bring about fertilization. Now, if the fallopian tube is blocked, there is no way the egg and the sperm can meet to form an embryo. So we need IVF. There are 40% cases where there is a strong male factor, like the sperm count is poor, or the sperm motility is poor, or the percentage number of sperm that are being formed in the testes is very low in number in terms of normal morphology. So there may be defects in the head of the sperm, the neck, or the tail of the sperm. There may be problems with the movement of the sperm, and the sperm numbers may be inadequate. There are women who may have endometriosis. There are women that may have fibroids, women who may have very resistant polycystic ovary syndrome that may need IVF. Then there are people who need IVF as a method of cryopreserving their fertility, especially if they're going for cancer therapy or they're undergoing some form of surgery for cyst, etc. So the reasons for IVF are multiple. And finally, there is that category of patients where all the investigations are normal in the husband and in the wife, and yet, despite trying as per all the instructions, they aren't achieving a pregnancy. Now, this category is called the category of unexplained infertility, and about 10% of couples who are infertile will have unexplained infertility. So, these are the indications why a person or a couple may need IVF. Now, in IVF, there are many ramifications. So it's not just the fertilization of the egg, sperm, creating an embryo, and doing an embryo transfer. As I mentioned earlier, we can freeze the embryos for use at a later date, provided they are good quality embryos. We can extend the culture of the embryo to a day 5 embryo and avail of a blastocyst embryo, which is supposed to be the top notch embryo, and it gives you a slightly higher pregnancy rate as compared to a day 2, day 3 embryo. To enable the embryo to implant, we can also do laser assisted hatching because the embryo needs to hatch to first of all implant in the womb. So you can avail of technology like laser assisted hatching, which facilitates the embryo to come out of the shell and start the implantation process. Embryos can be frozen because they are really sturdy organisms that can be frozen. But today we can avail of egg freezing also as a part of the IVF cycle. Say a woman is single, career oriented, and she wishes to cryopreserve her fertility. You can come through for an IVF cycle for just egg cryopreservation. And when you think the time is appropriate and you have found the right person with whom you would like to start a family, you can have these eggs that have been frozen, defrosted, fertilized, and embryos can be formed. And the good news is that if you have frozen these eggs, say at the age of 30, and you're planning to start a family at 37, these eggs are young and therefore the embryos will be of better quality and the chances of implantation and pregnancy rate become better. Same for men who are, wanting to cryopreserve their sperm for use at later date, men who are undergoing surgery, chemotherapy, radiotherapy for testicular cancers, they can also freeze their sperm so it can be used at a later date via IVF treatment. Through IVF treatment, we can help women who do not have eggs in their ovary or their egg count and egg quality is very poor. We can help them through IVF using donor egg therapy. So, donors are typically young women who have proven fertility, have children. We know for a fact that they have good quality eggs. They are less than 30 years of age, and their eggs can be collected via IVF treatment, fertilized with the husband's sperm, and embryos can be generated, and then the wife can avail of the donor egg embryo transfer and achieve a pregnancy. Similarly, we can avail of surrogacy. So, supposing a woman has a uterus that is damaged, say maybe because of surgery, because of tuberculosis, or has had her uterus removed, we can go through an IVF treatment cycle using her eggs, and the embryo can be transferred into a surrogate or somebody who's going to carry the baby for her. These are all the different types of IVF therapy that you can avail today thanks to the advancement in science and technology. IVF can be an emotional roller coaster. IVF costs money, and therefore, when you enroll for an IVF cycle, you must be totally committed as a couple to go through this therapy. When you register for an IVF cycle, it is important that you modify your lifestyle at least 3 to 4 months before embarking on the journey of IVF treatment. You must have a healthy diet. The diet must comprise of, greens, salads, fruits, proteins. You must quit alcohol. You must not be smoking. You must consume at least 2.5 to 3 liters of water. And finally, it is very, very important to indulge in at least 45 minutes to 60 minutes of exercise on a daily basis. Fitness comes first. Please start the periconception medications that your doctor has advised you, especially things like folic acid, calcium, vitamin D, etc. Make sure your blood sugars are under control. Make sure that you are screened for viral infections like hepatitis, HIV, syphilis, etc., before you embark on this journey. Apart from that, I think yoga is very useful. You have to maintain your calm and cool during this treatment cycle that will span between 4 and 6 weeks till you get your pregnancy test result. There are counselors available who can talk you through the journey. Now, fortunately for us at Fortis Hospital, we have all the technology that I mentioned earlier through my talk. So, including cryopreservation of eggs, sperm, embryos, blastocyst culture, laser assisted hatching, donor egg, donor sperm, surrogacy, all of these things can be availed. So, this is in brief about IVF. And if you have any questions, I'm very happy to take them on board. So, the first question I have is, what are the potential risks and side effects associated with IVF treatment? So, that's a very good question. So, when we give you hormone injections, the estrogen levels rise. Now, some women may get headaches associated with the rise in the estrogen level, and you can take adequate hydration and simple paracetamol during the treatment. In women with polycystic ovary syndrome, you may get hyperstimulated, which means that on an average, if I'm expecting someone to have about 5 to 12 eggs during an IVF cycle, you may end up with polycystic ovaries having 25, 30, 35 eggs. So you are obviously hyperstimulated. At such point in time, not only will your ovaries be very heavy, you will feel like a constant discomfort in your tummy. And once we collect the eggs, you will not have an embryo transfer in that cycle. All the embryos created will be frozen, because if we were to transfer the embryo, you will surely have a wide spectrum of problems associated with OHSS, like fluid filling up in your tummy, fluid filling up in the lungs. You can get blood clots, and you can be a very sick person. So, although the incidence of OHSS is small, but it is something that needs to be considered, especially in women with polycystic ovary syndrome. Now, typically, the reproductive career of a woman where you can actually start availing of IVF is anywhere between 23 and 50. If you are more than 50, I mean, as per the ART law, you cannot avail of IVF anyway in India. But the younger you are, the quality of your eggs is better. The older you are, you need more attempts at IVF. The egg quality, the embryo quality will be suboptimal. The chances of failure, the chances of miscarriage, because there is abnormal genetic configuration in the embryo, would be higher. Now, typically, we say that you can go through up to 3 attempts at IVF. Now, the younger the patient, if you are less than 35 years of age, your realistic chance of achieving a pregnancy through IVF is anywhere between 45 and 50% per treatment cycle. Once you cross 35, your realistic chance of pregnancy starts coming down. So it may drop down to between 20 and 30%. Once you cross 40 years of age, your realistic chance of pregnancy, even with IVF, is around 8 to 10% with your own eggs. Of course, if you take donor eggs, your chance of pregnancy at any point in time should be around 45 to 50%, because the egg donor is typically a person who is less than 30 years of age. So, if the first cycle is unsuccessful, and should you have embryos that are frozen for you to use at a later date, you can always avail of that. And frozen embryos do give a very good chance at pregnancy. But say you do not have embryos that are frozen for use at a later date, because to freeze, I can freeze anything under the sun. But the test of that embryo quality is when we defrost it. And should the embryo quality not be good at the time of freezing, the defrosted embryo will not be a good quality embryo, and it will perish. So, therefore, if you have good quality embryos, you can go for frozen embryo transfer. But if you don't, you must avail of the second IVF cycle. Now, please do have a detailed chat with your fertility specialist about the reasons why you should or should not proceed with the second cycle. Now, generally, if you've completed 3 cycles of IVF using your own eggs, embryos, and it's not happened, it's time to move on. You can move on to either having donor embryos, not donor embryos, donor eggs, donor sperm, whatever the permutation combination, or you can go for adoption. So these are the things that you must bear in mind. And so at the end of 3 cycles, generally about 60-65% couples would achieve a pregnancy. If you haven't, then you have to be very pragmatic and look at the realistic options ahead. I hope this answers the 3 questions that have been put to me. One more point that I would like to make here is people think that babies formed from IVF are abnormal. Actually, the realistic chance of having a baby with a congenital abnormality in the population anywhere between 3 to 4%. that women having IVF, can also have baby with congenital abnormalities, but the realistic chance of that is about 5 to 6%. So it's not hugely different. Therefore, you should not have the fear for that. Today, there is technology to do pre implantation genetic screening. And most importantly, nature intervenes should the embryo that has implanted be abnormal. So, you will suffer a miscarriage. If the pregnancy goes beyond 12 weeks, then there is always technology like chorion villus sampling, amniocentesis, double marker test, non invasive prenatal testing that can be done to ascertain if your baby is carrying any chromosomal abnormality and whether we need to intervene and stop the progress of this pregnancy. Any more questions? Okay. So, right. So thank you very much for a patient hearing. And once again, I'd like to thank Vishaka and team for giving us this opportunity to talk to all of you. As I mentioned earlier, I'm a senior consultant gynecologist and head of reproductive medicine at the Fortis Hospital, Bannerghatta Road, Bangalore. And I'm available for consultation Monday to Saturday between 8:30 a.m. and 5 p.m. every day. Thank you so much for a very patient hearing.